Hello, my name is Sheila Hardesty, and I am presenting a PowerPoint presentation that I have completed for my evidence-based practice course through Davidson-Elkins College. I'd like to introduce my audience. This is Marge Hardesty, my mother in the red shirt, and my sister Becky Hardesty. My presentation today is about nursing documentation. It is a research proposal presentation. Our research question is, will identifying and reducing common barriers to required accurate nursing documentation improve the quality of patient care? Little background: nursing documentation is to be clear, concise, and accurate, with no omissions of pertinent information. Communication through documentation should quickly alert others providing care to changes in a patient's condition. Communication through documentation broadens the understanding of human experiences and responses to illness, rehabilitation, disease, and death. I already gave you my research question, but I'll go ahead with my introduction here. Through clear, concise documentation, nurses make decisions about their patients' care needs, track changes in their patient's acuity level, and safeguard their patient's continuity of care. As professional nurses, inaccurate charting or omission of necessary details from our documentation can have negative effects on the delivery of quality patient care. Nurse managers are always on a quest to improve nursing documentation, thus ensuring quality of care and adequate reimbursement while meeting legal requirements. I put together some keywords and terms, and I'm not going to go through each and every one of those because of time purposes, but if I use a term you don't understand, you're welcome to ask a question about it, and the definitions are here with my references for any medical terms you may not understand, such as acuity, which is the measurement of intensity of nursing care needed by a patient, the acuity level of how much care they need. And so that's there for your reference. And then I also have included my references here to be acknowledged by my audience and my instructor. As far as the statement of the problem, in most healthcare facilities, errors or omissions in documentation are ongoing. Nurses are responsible to review physician and pharmacy documentation and play a vital role in avoiding or correcting any errors. Patients are entitled to safe, quality care. Poor documentation can lead to medication errors as well as errors in treatment. When a medication is given and not documented, there is a chance it will be given twice, which may or may not cause harm to the patient. When a physician or pharmacy order needs clarification, it is imperative the nurses carry out the process. If the order is not clarified in a timely manner, the patient may receive the wrong medication or the wrong dose, or even miss a dose of antibiotics, anticoagulants, or other important medications. A missed dose is a medication error or a delay in treatment. An omission of medication can lead to increased length of illness and amplify severity of sickness or disease. When antibiotics are missed or delayed, a patient may become septic. When anticoagulants are missed or delayed, a patient may develop a pulmonary embolus or a deep vein thrombosis. Omissions in documentation often lead to double dosing, which can be detrimental to the organs of the human body. A patient's assessment must be documented accurately to alert other healthcare workers to any change in the patient's condition. The documentation must be clear and concise. A patient's condition may deteriorate rapidly, with cardiac arrest being the outcome. Accurate documentation can communicate changes in condition, alerting healthcare workers to the possibility of impending cardiac arrest. Through clear, concise documentation, doctors, nurses, and other healthcare staff may be able to implement interventions to prevent cardiac arrest or be prepared to quickly initiate a code, possibly saving the patient's life. And we refer to a code you probably know as when someone's heart stops and we start CPR as far as bringing them back to stable condition. The study I have planned will identify the common causes or barriers to accurate nursing documentation. This is the purpose of the study. The data will be analyzed to break down these barriers, improve quality of care, and reduce incidence of infection and med errors, which will result in decreased incidence or length of illness and possibly save lives. Errors of documentation often result in harm to our patients, magnifying their sickness or disease process. To ensure quality of patient care delivery, it is the responsibility of the healthcare industry to explore why and how these mistakes occur through ongoing root cause analysis. Analysis for causes of error will be used to improve the documentation process on the Med-Surg unit where I work. Nursing management will develop and implement interventions to reduce barriers to professional documentation. These interventions will enable the Med-Surg nurses to communicate more clearly and chart necessary patient information while they're charting necessary patient information. I have reviewed some literature for this presentation. I'll go over that with you. It is important for nurses to record information so that their documentation has meaning and communicates assessments, observations, and any changes in the patient's condition. It is necessary to document positive and negative findings, communicating clear facts to all healthcare professionals involved in the patient's plan of care. Communication through documentation will quickly alert others providing care to changes in condition. Nursing Journal emphasizes the use of correct grammar, spelling, terminology, approved abbreviations, and measurable terms to avoid misinterpretations of our documentation. Another literature review, an improved nursing documentation system was needed at Riverview Medical Center. A system was developed to save the nurses time through introducing the possibility of flawless documentation with voice-activated software programs. It was noted in Nursing Management magazine the fact that regulatory agencies visit healthcare organizations to conduct chart reviews and draw conclusions about the quality of patient care and the responsiveness of the healthcare providers to establish standards from the documentation recorded by the doctors and nurses. In years past, nurses charted brief notes modeled to a generalized plan of care, documenting their patient responses to illness, disease, treatment, and their environment. The advancement of technology in healthcare today requires nurses to chart ongoing data, collecting and sorting what is pertinent and measurable for clear, concise documentation. Trefino notes also in nursing management that a medical record containing errors and omissions in documentation jeopardizes adequate reimbursement, clear communication between healthcare providers, and continuity of care, as well as legal requirements. Standard treatment protocols are used by many facilities and organizations. Our standard protocols followed with accurate documentation to prove the care was given. According to pre-hospital emergency care, there are errors of omissions in the treatment of pre-hospital chest pain patients, documented or not documented by paramedics without protocol adherence. Pre-hospital emergency care reported a sample of emergency medical service records were obtained from 4 ambulance companies with written documentation revealing a significant number of patients did not receive care, or it was not documented that they did receive the care recommended by protocols. A performance plan must be put in place to improve adherence to protocols and documentation of the delivery of care, as well as increase lives saved in life-threatening situations. Infection control and hospital epidemiology notes that accurate documentation of vascular access in the electronic medical record is standard nursing practice. The National Health Care Safety Network completed a study to validate a process to measure central venous catheter days for nursing documentation. From nursing documentation, According to infection control and hospital epidemiology, error rates were measured using both manual and automated validation methods. These measurements allowed determination of error rates consistent with the NHSN methodology, a method in which errors of admissions or commissions could negate each other. An automated tracking tool to calculate the documentation error rate was used. Infection control and epidemiology also notes the electronic medical record provides a sustainable source of central venous catheter data without increasing the data collection burden. Feedback from the study was used to develop tools and implement interventions to eliminate errors of documentation of central venous catheter days, which could lead to inaccurate central venous catheter day counts. The journal emphasizes that central venous catheter day counts needs to be trusted for accuracy throughout the organization. The implementation of the process improvement interventions decreased errors in documentation to a minimal level. And anytime you have access, intravenous access, whether it be through a central venous catheter, a subcutaneous port, or a peripheral IV, it's imperative for maintain infection control that the documentation is accurate, because certain dressings must be changed weekly, peripheral sites must be changed every 72 hours, tubing must be changed every 72 hours, any maintenance fluid that's hanging must be changed every 24 hours. So that's why it's so important for nurses to document accurately to prove that the care was given. Evolving technology has increased the availability and accessibility of software, with documentation tools developed for the improvement of nursing documentation. These tools are available for trauma care, med-surg, ICU, and many other fields in nursing and in the healthcare industry. According to the Journal of Trauma Nursing, the Emergency Nurse Documentation Improvement Tool system was implemented as a performance improvement model utilizing existing computer software in a Level 1 trauma center. The journal also notes that the system provides the professional nurse with quick computerized feedback when the documentation of trauma case needs further attention. The journal also reports that feedback is provided in written form and uses peer mentoring to improve accountability in documentation, thus decreasing documentation omissions and mistakes by 21%, which is pretty significant. Excuse me. The study I have planned will identify the most common causes of barriers to accurate nursing documentation. Errors of documentation often result in harm to our patients, thus making it necessary for the healthcare industry to explore why these mistakes occur through ongoing root cause analysis. According to our textbook, qualitative research can be descriptive or interpretive. Descriptive research establishes basic knowledge of human responses to health and illness, whereas interpretive research is a form of analysis that involves extracting meaning from data, which requires thought or study on the part of the researcher. The methods I plan to use, of course, my research design is a qualitative descriptive study. The sample size and characteristics of the sample, the participants are a convenient sample of the 50 nurses on the med-surg unit at the hospital I work. My data collection will be the nurses will be completing a descriptive narrative questionnaire online that they will receive in an email. Data analysis, the descriptive questionnaire results will be analyzed in an interpretive way, grouped into categories and displayed with a bar graph, emailed to the participants, and presented at shift meeting for brainstorming and root cause analysis. Ethical consideration and consent. The med-surg nurses will participate voluntarily with hopes of 100% response rate related to the expected outcome of the study, which is the reduction of common documentation barriers on our med-surg unit, which will improve professionalism, job performance, charting, and quality of care. My data collection instrument will be a narrative questionnaire completed by the nurses on the Med-Surg unit. The questionnaire will consist of open-ended questions to promote validity. Open-ended questions generate meaningful data while giving the participants a chance to respond to each question with detail. The questionnaire will have a significant signature section stating the nurses are participants in a voluntary study. The signatures will be removed from the data before analysis to maintain the autonomy of the participants. All Med-Surg nurses will be encouraged to participate. Collecting the data in a systematic way will provide feedback to nursing management as well as the Med-Surg nursing staff. All Med-Surg nursing staff will send their completed questionnaire to our unit nurse manager in a return email via the internet. And the questionnaire, I won't go over the whole questionnaire, but it will have questions such as, do you chart everything or just what is required in order to leave work on time at the end of your shift? Does the acuity level of your patients interfere with your charting? Does the job performance of your assigned CNA affect your documentation? Is a few of the questions on the questionnaire. My expected results will be lack of knowledge or education and training, lack of communication between members of the healthcare team, job performance of your nursing assistant and other members of the healthcare team, lack of access to MD or pharmacy staff for clarifications to ensure accurate documentation or delivery of care, staffing shortages which affect your nurse-patient ratio, whether it be you don't have enough nurses on staff, or maybe you have enough, but you had an unexpected call off. Exhaustion related to long shifts or mandated shifts. And acuity level may be related to call bells or being at the bedside, giving patient care, assisting MDs with procedures or dressing changes and treatments. Also, the amount of required documentation and double documentation may be a barrier. Data analysis. The results will be grouped together by categories. Results will be emailed to the participants and presented at staff at shift meeting. Root cause analysis cycles will be run for the development and implementation of the tools and concepts to reduce barriers to documentation. The data will probably be presented in a graph similar to this. The barriers will be grouped by categories such as acuity and staffing, job performance of peers, documentation and transcription, environmental and time management. Some barriers will probably fit into more than one category. In conclusion, clear, concise documentation enables communication of changes in the patient's condition to implement necessary changes in their plan of care, thus protecting continuity of care. Identifying and reducing barriers to required accurate nursing documentation will improve quality of patient care on our Med-Surg unit. Applying qualitative, descriptive research or credible data enables our practice to be evidence-based. Do you all have any questions? No? Well, as in summary, as you can see, it is important for things to be accurate, to maintain infection control purposes, to make sure that we don't cause someone's illness or disease, acute disease, to last longer, to ensure that rehabilitation improves as quickly as possible. And once again, I ask that you acknowledge my references there, and I thank you very much.
Thank you.